Okay, so let's start. Thank you everybody for joining today's webinar. My name is Nikhil and I'll be the host for today's meeting. So we have webinars like this one every single Saturday, so be sure to stay updated. Now, our goal is to help as many students as possible, so we would appreciate it if you guys could share the word with your friends and family. And today we have the privilege of having Mr. Sharma as our speaker. He will speak about his job as a nephrologist. He'll talk about his work environment, educational experience, and he'll give us all an idea of what a nephrologist does. So now, Mr. Sharma, Dr. Sharma, we're really glad to have you today as a speaker. And can you give us a short introduction of yourself first?
Yeah, of course. Thank you, Nikhil, for inviting me and for giving me this opportunity to be a part of this wonderful initiative that you have created. And I'm so proud of you at such a young age. You are thinking out of the box and helping students all over the world. So I'm a trained interventional nephrologist here in the US. I am a specialist of kidney diseases. And further, I do specialize in patients who have end-stage kidney failure or patients whose kidneys are not working and they have to be on life-sustaining dialysis. I specialize in treating and taking care of their dialysis access. So to give you a brief background, when your kidneys don't work, kidneys are like a blood filter in your body and a very important organ in your body. And they filter your blood or filter out the impurities in your blood. Whatever is essential in your body is kept within your body, and whatever are the toxic products, you basically excrete out of your body through the urine. So that way the kidney is a blood filter. So when the kidneys stop working or the filter in simple terms get clogged or is not able to clean your blood, several impurities start accumulating in your body and can make you very, very sick. So two simple treatments for that are either you get a kidney transplant, but because there is a shortage of donors worldwide, not enough kidneys are available for transplant. And so for patients who cannot get a kidney transplant for one reason or the other, the next step left is dialysis, which means artificially cleaning your blood, taking blood out of your bodies, have it circulate through a machine. The machine acts as your kidney, take out all the impurities out of the blood, and give the clean blood back to you. And in order to do that, you have to have a dialysis access through which the blood can be taken out and given back to your body. So my job is taking care of those dialysis access. Those are called fistulas or shunts. And with daily use, they encounter some problems. So my job is to make sure that all the dialysis patients who have shunts or catheters, because it is their lifeline, I take care of problems that they encounter and do the needed treatment so that their shunts or catheters are working fine so that they can continue to have dialysis.
Thank you for that great explanation. So you mentioned how you're an interventional nephrologist, correct?
Yes.
So what's the difference between an interventional nephrologist and a normal nephrologist?
So a general nephrologist is a doctor who treats all the kidney disorders and write dialysis orders and evaluate the patient if they are good candidates for getting kidney transplants. Within nephrology, we have like 2 or 3 different subspecialties, if you would. And one of the subspecialties are called transplant nephrologists. They basically deal with the transplant kidneys or evaluate patients who are good candidates for transplant and then manage once you get a transplanted kidney, because that kidney is coming from a different donor, human bodies can reject donated organs from other bodies. So you have to be on very specific medicines so that your body does not reject the kidney that has been transplanted in you because it's coming from somebody else's body. So that's a very specialized field, and the doctors or nephrologists who take care of those patients are called transplant nephrologists. And then there are general nephrologists who will deal with chronic kidney disease, high blood pressure, which is called hypertension, and any plethora of diseases that can affect the kidneys. So interventional nephrologists basically focus on the dialysis access of the patient. So once patient who ends up on dialysis, we take care of their dialysis access. So like I was explaining to you earlier, in order to get dialysis, we have to take the blood out of your body that goes through a machine or called dialysis machine. The machine cleans the blood and the blood has to go back. In order for that to happen, you have to make sure that once the blood is taken out of the body, it doesn't clot. So the blood needs to come out at a very high speed. And before it clots, then we have to transfuse it back to the patient, okay? So that happens through either catheters that are inserted in your body in very large veins, or a more permanent solution to that is having a shunt or a graft or a fistula placed in your arm, okay? And because patients need dialysis at least 3 times a week, and because of repeated use, these shunts start to have problems. Either the veins will start narrowing down, or sometimes the clots can shut down. We call it thrombosis. So interventional nephrologist tries to manage all these problems by doing procedures which are called angiograms or fistulograms, and try to make sure that the shunt is working fine and there are no problems encountered. So in simple terms, an interventional nephrologist does procedures related to those dialysis access as compared to a general nephrologist who deals with the medicine side, like seeing patients in the office setting. An interventional nephrologist is more like a surgeon or a proceduralist, if you may say, who does basically procedures on the shunts or dialysis access to the patient. Does it make any sense?
Yes, that makes sense. So an interventional nephrologist works on the procedures related to dialysis, while the general one works on the medicine, correct?
Right. That is.
So as an interventional nephrologist, what do you do on a daily basis at your job? Are you always working on dialysis, or sometimes when they're not dialysis patients, what are you working on?
Yeah. My job is actually very interesting, at least to me. I have like a couple of weeks a month where I do procedures. So if it is my procedure week from morning 8 o'clock to until 5 or 6 o'clock, whenever your day is done, I'll do procedures based on the patients who need these procedures to maintain their dialysis access. And my next week may be in the hospital taking care of inpatients. So patients who are admitted to the hospitals, and if they have any kidney failure or kidney problems, the hospital doctors would consult a nephrologist. So that week I'm working as a general nephrologist, trying to consult on patients who have kidney problems. And my next week may be in the office setting, trying to see patients who have problems like hypertension or any patient who have kidney diseases who are not sick enough to go to the hospital. They are healthy and they just have kidney problems, and we see them on an office setting, on an outpatient setting. So it's like changing your hat every week. One week you're a proceduralist, the next week you're working inpatient, and the next week you may be working in the office setting, seeing clinic patients.
So you work on both sides of the spectrum, actually. So first, I have a quick question. Someone sent in the chat. Can people live on dialysis for the rest of their lives if they're having severe kidney problems? That was a question someone in the chat sent.
Yes, definitely. That's a very good question. Depending on what part of the world you're living in and how much access do you have to the resources, yes, you can live on dialysis for a long time, okay, provided you have access to dialysis and you are regularly having dialysis. So here in the United States and in most of the world, you need, if you are on hemodialysis, which means in simple terms, taking the blood out of your body, circulating through a machine and giving it back to you. So that you would need to clean your blood at least 3 times a week, or in lesser developed countries, at least twice a week or so, okay? And there are patients who have been on hemodialysis for 20, 25 years, even 30 years, okay? So as long as you have regular access to dialysis, you can have a normal uh, life, okay? And the longest patient I personally had has been on dialysis for 28 years. And if you get a kidney transplant, that is the best way of treating a kidney failure. So if you're lucky enough to get a transplant or a kidney from person who was donated, a living person or person who died and his organs were good and harvested in time, and that kidney is put up in a patient or transplanted to a patient who needs a kidney, that is the essentially the best way, and you can have a normal life once you have a kidney transplant. And people have had kidney transplants for 30, 20, 30 years, you know. So I hope that answers your question.
So you mentioned how that they have dialysis procedures maybe once or twice a week, you said, correct? To clean their blood?
Yes, at least here in the US, we try to do at least 3 times a week. So either it's Monday, Wednesday, Friday, or is it Tuesday, Thursday, Saturday? Depending on in lesser developed countries like Africa or even India or Asian countries where we do not have that many dialysis machines, and there are a lot more patients who need to be dialyzed. Sometimes they try to do at least twice a week or so. You have to understand that a kidney is such a beautiful organ that it works round the clock, 24 hours a day, 7 days a week, 365 days. And that is the reason why your blood is continuously getting cleaned by the kidneys, okay? Now, just to make it very simple, the example I give to my patient is if you're driving a car, you have an oil filter that you need to change every 3, 4 months, right? Just imagine that if you don't change that oil filter, what will happen? If the oil will not get cleaned, the oil will get dirty, and the deposits would start getting deposited on your engine. And down the road, if the oil and the filter are not changed, your engine will go kaput one day, right? This car will stop running. So take the same example for your body. The blood is like oil in your system that is keeping the engine running. And the kidneys is like the filter that cleans your blood continuously. And once that filter stops working, then the blood will gather impurities, and it's only so long that you can survive. So in order to, if you have kidney failure, you have to get your blood cleaned regularly on a regular basis through dialysis, at least 2 to 3 times a week in order to survive.
And if people are having dialysis 2 to 3 times a week, how long does one dialysis session last? So how long do they have to go in for? And
Yeah, very good question. So dialysis can basically be done in 2 ways. The one that I have been describing is called hemodialysis. Heme stands for blood. So that is a form of dialysis that involves taking out blood from your body, cleaning your blood, and giving it back to you. A typical hemodialysis session lasts anywhere from 3 to 4 hours. So 3 to 4 hours, 2 or 3 times a week is the minimum that is needed. There is another way of dialysis that you can do at home. It's called peritoneal dialysis. Peritoneum is the cavity that is in your abdomen or in your belly area. So that dialysis works a little bit different. You have a catheter placed in your cavity, and there's a membrane in your belly that is called peritoneum that serves as a filter. And this sort of dialysis does not involve any blood. So basically, you are instilling fluids into your belly through that catheter and let those fluids sit for like 3 to 4 hours. And then that fluid is drained. The peritoneum, that is the membrane in your belly, acts as a filter and tries to clean the blood. So you're instilling clean fluid and let it sit for 3 4 hours. And after 4 hours, you drain all that fluid, and that has all the impurities that are in your blood. Okay, this makes sense. So it does not involve any blood, but the blood is getting cleaned by your own body in a different mechanism or a different way that involves the peritoneum. So that is peritoneal dialysis. And many lesser developed countries, or even developed countries like Canada or Europe, they have a lot of patients who are doing peritoneal dialysis. And it's a very effective way of doing dialysis, and actually a cheaper way of doing dialysis too.
Thanks for sharing that. So, and you mentioned how both of these dialysis last very long, right? 3 to 4 hours, right?
Yes, so peritoneal dialysis, because it's a slow way of cleaning your blood, most of the patients, they do dialysis at night. So we have either cyclers that will automatically instill fluid into your belly and take out fluid after 3 to 4 hours. And you run these cycles anywhere from 4 to 5 times throughout the night. So you are basically sleeping and you're connected to a machine, and the machine is just doing its job without you knowing anything. So most of our patients, they hook themselves to the machine at night when they are at home, and they go to bed. And in the morning when they wake up, the cycles are done, they disconnect themselves and off they go, and they have the liberty to spend their day in whatever way they can, as compared to patients who are on hemodialysis, who are getting their blood cleaned directly through the machine. They have to go in centers 3 times a week for 3 to 4 hours each.
And you previously mentioned how some people stay on dialysis for 20 years and even more than that. So are they just staying on dialysis until someone donates a kidney to them, or even after someone donates a kidney, do they still have to do
No,
dialysis?
no. Once you are lucky to get a kidney, the kidney basically takes over. And if the transplant works the way it's supposed to, then you don't need dialysis anymore. So that is the beauty of a transplant, that once you have a donated organ that is working the way it's supposed to, you just have to keep on taking immunosuppressants or the medicines that prevent rejection of the transplanted kidney. As long as you're taking those medicines, you're good. You don't need any dialysis anymore, because the transplanted or the donated kidney will do the job.
How often do these dialysis patients get kidney donors?
Yeah, so that's a very good question. Here in the US, there's a long waiting list that can average 5 to 7 years wait time. So we have almost 400,000 patients who have end-stage renal disease here in the US alone. I'm not talking about the world. And you can think about yourself at the world level, how many patients there are with kidney failure. Here in the US, at least out of those people, majority of them are needing dialysis. There are almost 100,000 people, a rough ballpark figure, who are waiting for kidney transplant. So 100,000 people who are on dialysis, who kidneys have failed and who are interested in getting a transplant are waiting for the kidney to become available. Hence, foundations like National Kidney Foundation and American Society of Nephrology, they spend a lot of resources and time in educating the general public how important it is to become a donor. At least have it listed on your ID card that if God forbidding, something happens to you and you end up dying, at least your organs can be used and harvested in time, and they can go to someone who really needs them. Or even there are a lot of people who, because human body, we have two kidneys, and you can live a normal life even with one kidney. So if you have a near or dear ones or a close friend who needs a kidney, we do encourage family members and friends to who are healthy enough to donate a kidney, and that kidney is coming from a living person actually work much better as compared to harvested organs from deceased people.
Thank you for sharing that. So typically we hear about organ donors, but we never really knew that it was that rare. So thank you for bringing awareness to that. And
Right.
um, my next question is, so to become an interventional nephrologist, what education or degrees did you need to get to your current position?
Yeah, so Nicole, basically, to become any kind of doctor, you of course need to go to med school. Here in the US, 4 years of college degree is needed. And then you give your medical school entrance exams, and once you're selected, you spend 4 years in med school uh, and 1 year of doing your rotating internships. And after you finish your med school, you apply for residencies. So depending on if you want to become a surgeon or want to become a medicine doctor or a pediatrician, those residencies are typically anywhere from 3 to 5 years, depending on what specialties you want to go to. Surgeries usually are longer residencies, and medicine, internal medicine or family medicine is 3 years. After you complete that residency, if you want to further subspecialize, like I did in nephrology, after completing my 3 years of internal medicine, that's another 2 to 3 years of training. So nephrology, general nephrology is usually 2 to 3 years, depending on the program you apply to. Some programs are pure clinical, they are 2 years, and some programs have 1 year of research, so that's why they are 3 years. And I was lucky enough to further subspecialize in intervention nephrology within like 2 years of my training. So rough ballpark figure, about 5 to 6 years of further training after you finish your medical school.
During medical, for you, you mentioned that you did nephrology. So for during your med school years, did you know that you were going to choose nephrology, or were you still unsure about which pathway you wanted to go on?
No, no, like most people, I wasn't sure what I wanted to do because when you are in med school or even in college, uh, there are very few people who are crystal clear that this is the field I want to go into. So I wasn't sure. I was sure that I wanted to become a doctor. That's how I ended up in med school. But this is just a part of evolution of your journey, right? As you transcend your journey, you try to see what interests you more or what uh, passions you have in a field. I was exposed to a few mentors during my residencies who encouraged me to do more rotations in nephrology, and I liked doing procedures. And when I saw the nephrologists doing procedures on their own patients, I was really very passionate to go into this field. So, but it was only up till I was a second year medicine resident. That's when I decided that nephrology is really very intellectually very stimulating. And once I discovered more about interventional nephrologist, and I was clear that this is a field I want to further subspecialize.
My next question is, after your education, what all jobs do you have before becoming an interventional nephrologist? Are you first a general nephrologist, or do you directly become an interventional nephrologist?
Yes, Nikhil. So because I trained during my fellowship as an interventional nephrologist, I was clear that the job that I will be choosing should utilize my skills that I spent so much of time in trying to accrue. So my first job did start as an interventional nephrologist, but I didn't want to do procedures all day long, all throughout the year. So I tried to find a job that would give me opportunities to do 50% intervention work and then 50% general nephrology. So I graduated from LSU, Louisiana State University, Shreveport in Louisiana. That's where I did my residency and fellowship. And my first job was in the adjoining bordering state of Arkansas. I was in a small town, Hot Springs, where I stayed for about 7 years or so. And it was a very rewarding 7 years, I would say, because it was my first job. And whenever you start anything new in life, um, there are always challenges that you come across because you have to tread your path, you have to figure out your ways, and it's like learning on the way because you're fresh out of training. But those 7 years were really very rich and rewarding in experience. And then recently I decided to move to closer to the West Coast. So last year I moved to Reno, Nevada, and that's where I am. And I'm doing the same thing. I'm doing 40 to 50% intervention, and then rest of the time as a working as a general nephrologist.
Thanks for sharing your journey from Louisiana to Arkansas to Nevada. And my next question is, so you mentioned that you knew that you wanted to be a doctor, but you didn't know that you wanted to do interventional nephrology.
Mhm.
And my question is, when did you decide that you wanted to be a doctor? Was that in high school, or did you always know from a young age that you wanted to be some sort of doctor?
So that's an interesting story, and if you may, I would like to share my story with all of you, and I hope it will motivate few people. So I come from India, and I was born in a very small town. And when I was in high school, I was in 10th grade. My dad was in the army, and unfortunately, he was killed while fighting with terrorists in India. And I was very young and uh, not mature enough to comprehend what had happened. But he was like, to any other boy, my dad was my hero. And when he suddenly passed away, it was like life has turned upside down. I didn't know what to do because my hero was not there in my life. But my dad always wanted me to excel in my life. He always motivated us, encouraged us, being an army officer. And he was the first graduate in his family. We came from a very poor family in India. And he used to walk 7 miles every day just to go to school back in India. And he used to share stories like these to us. And he moved us from the village to a small town where me and my brother could go to school. And his stories were so motivating to us. And it was like a privilege of having a bicycle that you can ride to school as compared to him who has to walk 5, 7 miles every day to go to school. So to make long story short, when my dad passed away, he had mentioned once that I want to see a doctor in front of you, and if you, that'll be really good because there is no doctor in our family, and I want you to be the first one in the family. So when he passed away, that thing stuck in my mind that I have to do something in my life. I have to make my dad's dream true, and I will do whatever it's in my might to make that happen. So it was more for to fulfill the wish of my dad that I was motivated and inspired that I will do whatever it takes to be there and become a doctor. So that's the guiding force that motivated me to work very hard and study a lot and get into a med school back in India.
Thank you so much for sharing that motivating story about how you. Hello, can you hear me?
Yeah, it's patchy, but I can hear you.
So I would like to say thank you so much for sharing that motivating story about how you decided to become a doctor. And my next question, someone from the chat asked a question, and the question is, can you take a kidney from anyone, or does it have to be someone specific that donates the kidney?
Yes, so human body works very mysteriously, and we have a very uh, protective system to protect us from getting sick. We have a very strong defense system in our body, which is called our immune system. So anything external that we are exposed to, our body has the capability to fight. And this is a natural defense against germs and common infections that we are exposed to on a daily basis. So to boil it down to very simple terms, if we are exposed to any infection, our body has the ability to fight that infection by making cells that will try to kill that bug or fight that virus without us having getting too sick. So when you transplant an organ which does not belong to you or belongs to others, your body sees that organ as foreign cells, and it tries to mount the same immune reaction. It tries to fight it because those cells don't belong to your body, they are coming from someone else. The closer the cell lineage is to your cells, or in other words, your brother or sister will have more resemblance DNA wise as compared to you, you are bound to pose lesser fight to those organs that are coming from your own family, okay, as compared to a totally different stranger who will have a totally different DNA that comes to you. So not to say that your body will not fight against the cells from your brothers or your parents or your sisters, but it will, and that is why you need medicines to calm down or suppress the immune cells in your body. So to answer the question directly, yes, we have those capabilities of taking an organ from anyone and transplanting into you, but we try to match the organs as much possible so that the immune reaction is the least. So the most common thing we try to do is at least the person who is donating an organ to you at least matches your blood type. Okay. And if that is possible, well and good. And then there are very other specific tests we do on a molecular level that try to match the organs as close to your DNA, or to, in a sense, to make sure that the immune reaction is not a very strong reaction. And it's the least amount of reaction so that we don't have to give you a heavy dose of immunosuppressants, and the donated organ has the best ability to survive in the recipient's body. I hope it makes sense. I was trying to make it very, very simple so that everyone can understand this.
Um, yes, that makes sense. So my question is, if you mentioned how there's many different ways that you try to make sure that the kidney fits well with the body, like you said, at least try to match the blood type, and there's other ways also. Is it possible that even after you match the blood type and you do all the procedures, is it possible that the body still does not accept the kidney?
Yes, yes. Without medicines, if you, except if you are an identical twin, because you are born from the same mother and at the same time, that is the best possible case scenario, that an identical twin has the best chances of receiving an organ without rejecting it if it comes from an identical twin. But if it is a non-identical twin or a sibling, then you are going to pose an immune reaction no matter what. Okay. So yes, every transplant patients does get a lot of medications to suppress the immune cells in your body so that you bring the guards in your body down so that they don't fight the transplanted organ. So we have means and mechanisms and newer medications and therapies to tone down that reaction to a minimal so that you are able to accept an organ from a totally stranger person as long as the major tests are compatible.
And my next question is, with your job, you do dialysis on the kidneys that have kidney failure. And um, so with this job, you have to be in office in person to do the dialysis, correct?
Yes, so we have specialized dialysis centers, Nikhil, um, here in the US and the rest of the world too. These dialysis centers have anywhere from 10 to 20 to 30 chairs, and each chair has its own dialysis machine. So these centers are specifically 100% catered to taking care of dialysis patients. So a typical dialysis patient would walk in and they would get checked in, and the dialysis nurses and technicians are there to hook their fistulas and shunts or catheters to the dialysis machine. And a dialysis doctor or a nurse practitioner or a mid-level provider will check on those patients every week, once a week at least, so that to make sure that their treatments are going okay, and if the nurses or technicians are having any issues, we can deal with them. And doctors are always available to their staff on the phone. There is always someone in the group that is on call. So if the nurses have any problems, they can at once reach us and call us with any questions.
And how did, if you have to be in person to do these dialysis, so how did COVID affect your work?
COVID has changed the world a lot, and the medical field has been at the upfront who has taken a brunt. Um, our kidney patients are one of the sickest patients, as you can imagine. And unfortunately, the immunity of our patients is very, very low. Um, and our patients have a lot of other medical diseases that they are fighting too. Most of our patients have diabetes or very high blood pressures. So these patients are a very high risk to catch any kind of infection. And the same thing applies for COVID too. And since this virus has come around, a lot of patients who have been on dialysis had unfortunately got infected with it, and they become very, very sick and had to go to the hospital. And while they're in the hospital, then if they are on dialysis, we always get called on these patients to take care of their dialysis needs. And because these are very complicated patients, we are essentially the leading doctors to manage their care when they get sick enough. In the outpatient setting, patients who have chronic kidney disease or are on dialysis, we are trying to deal with the COVID. It's a very challenging situation, but like uh, any other field, we are trying to do our best to keep our patients protected, wear masks all the time, and make sure that they don't get exposed to this virus, or if they get infected, they are shielded in from infecting other patients or spreading the virus in the community.
Have you personally done any procedures on people, on patients that have had COVID?
Since the outpatient procedures we try to avoid unless they are really emergent. Like the most emergent procedure in our patient is if they're clotted, if their dialysis access is not working, like the catheter gets clotted or the fistula or shunt gets clotted, and they are not able to have dialysis. It's a life or death situation for our patients. So there are rules and regulations for outpatient vascular centers, and if the patient is actively COVID positive, most of the times they end up being sent to the hospital so that we can take care of them in an inpatient settings. Outpatients, we try not to bring the patient who has active COVID infection going on um, to protect our staff and help uh, prevent spread in the community. So yes, I have done procedures on patients who have been COVID positive in the hospital setting, but not in the outpatient setting.
Thank you for explaining that. So someone in the audience sent a message and sent a question in the chat, and the question was, what causes kidney failure?
Very good question, and I applaud the person who is asking this. Two most common diseases in this country and actually worldwide that cause kidney failure are very well known to all of us. And the most important cause is diabetes, um, which is high blood sugars, and the second most important cause is hypertension, which is high blood pressures. So if you have high blood pressure or if you have diabetes or you're running high blood sugars, these are the two most important risk factors of developing a kidney disease. Uh, and diabetes is one such disease. If you have uncontrolled diabetes, the longer you have it and the more uncontrolled it is, the more damage it causes, not only to the kidneys, but to the rest of your body too. So diabetes and hypertension are the two most important causes. There are multiple other diseases too, but these constitute almost uh, 85 to 90% of the causes that cause kidney diseases and cause patients to end up on dialysis.
So with these patients that end up on dialysis, how many patients do you have in your hospital that come for dialysis?
It depends on the community and the region that you're working in, Nikhil. If you're working in a large metropolitan area, typical nephrology practice manages anywhere from 500 to 700 dialysis patients. There are practices who have even 1,000 to 1,500 dialysis patients too. My practice here in Reno, we have almost 750 dialysis patients, and we cater to a large part of the state. So we have a lot of rural areas too. And these patients are coming from a very diverse area. In densely populated areas or bigger cities, of course, you'll have more patients coming from a smaller area. So it depends on the region that you're serving and the part of the country that you're living in.
My next question is some relates back to when you said how dialysis patients have to come around 3 times a week for their dialysis. And so how do these patients go on vacation if they have to attend dialysis 3 times a week?
Yeah, very, very good question. So here in the US, we have dialysis centers located throughout the country. So let's say if you're on hemodialysis and you want to travel from Nevada to, let's say, Dallas, Texas, or any other city in the country, we encourage our patients to make their plans and let our dialysis center know in advance, 1 or 2 months in advance. Of course, this needs a lot of planning, and once your itinerary is decided or you let us know that you'll be gone for a week or so, we try to contact the closest dialysis center where you will be traveling and try to set up your dialysis at that center. And there are companies that are happy to arrange your dialysis as a visitor for a week or so while you're in that area. So that is for hemodialysis. Hemodialysis can also be done at home, where you kind of cannulate yourself and you are in charge of running the dialysis yourself. And many patients are happy and very competent to do that at home. For such patients, we have very small dialysis machines that are the size of a large briefcase, and they can actually put that in the trunk of the car, or if they want to travel locally, within that area. So they just need an electrical circuit availability to hook that machine at night to be able to do dialysis. Of course, you have to take your supplies with you. And then the peritoneal dialysis, that's the easiest way to travel because you're doing dialysis at home. That machine is even smaller, the size of a smaller briefcase, and you can carry it even on an airplane, and that can be checked in. And as long as you have the dialysis supplies, and these days here in the US at least, if you let the companies know beforehand, they can deliver those supplies to your destination area where you're visiting so that you don't have to carry everything with you. So yes, our dialysis patients go on cruises as well, as long as they are able to carry their supplies and their machines with them. So they have a lot of options. And the only thing is they need to plan ahead and let everyone or their providers know so that we can plan accordingly.
Thank you so much for explaining that. I was pretty curious about how they would travel, and you explained it very nicely and made it easier for people like me to understand it. So I really appreciate that. And my next question is little different. So aside from your job, do you have any hobbies that you partake in?
Yes, hobbies are very important, and I would encourage everyone who is listening to at least develop some hobbies. You know, if we focus on just work, 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 life will become very monotonous and it can bog you down. Of course, in medical field or even in other professions, if you are just busy working, you won't be able to enjoy life. So yes, I do have a lot of hobbies. I love to read books. Books are my mentors, and I would encourage all the younger students and younger generation to at least develop this hobby to read books. Try to read at least, if not more, one book a month. And books are your greatest mentors and friends that can be. Um, one person told me when I was very young that rich peoples have a lot of books at home, and poor people, they have a lot of TVs, big spaces at home. Okay, and one of my mentors said that books are the easiest access to a knowledge base sitting right at your home. So I would highly encourage to read as much as you can. That is one of my hobbies. I also like to speak to people, and I have spoken at several public seminars. This is a hobby I'm trying to develop more. Um, I like to paint, spend a lot of time on acrylic painting. I also like to write poetry and write journals. And lately, I have also tried to do a little bit of woodwork and carpentry. So these are the some of the hobbies I have.
Thank you so much for sharing your hobbies. And it's very important to have hobbies so that you have more fun in your life, like you mentioned. And also, I can tell that you like books by your virtual background. I can see all the books in your. Um, and my next question is, do you have any advice for kids if they would like to follow your footsteps? Is there anything they could start doing right now as a high schooler to prepare for becoming a nephrologist if they want to be a nephrologist in the future?
Yes, definitely. Like Abraham Lincoln said, whatever you do in life, be good at it. So not necessarily that you have to become a medical profession or a doctor. It's very good because the world needs a lot of doctors. There are a lot of sick people, especially in developing countries. So it's very good that if you want to become a doctor, you have to study really very hard. But whatever field you choose to go into, try to be the best in that field. That is the only mantra that I would highly encourage people to follow. And uh, there is no alternative to hard work in life. Whatever you want to become in life, you have to understand that you have to put in the grind, you have to put in the hard work if you want to be successful in life. You know, like Thomas Jefferson once said that I find it that the harder I work, the more luckier I get. Okay. So when you see people who are like at the top of their field, who are very successful, be it in medicine or be it in entrepreneurship or be it in business, we try to think that, oh, that guy must have gotten lucky and he's the CEO of such and such company and he's so rich. But most of us, we sometimes tend to forget the hard work and the labor and the years that have taken for them to be at that spot. So there is no shortcut to success in life. If you want to be successful in any field, you have to put in the slog, you have to put in the hours, you have to put in the hard work to be there. As long as you are passionate about your career choice, as long as you're passionate to be successful and become someone and something in life, no one can stop you. There are plenty of opportunities there. As long as you are determined to get from point A to point B, there is no one that can stop you. Yes, there may be stumbling blocks in between, but as long as you keep on getting up and keep moving forward, like uh, Martin Luther King Jr. said, that if you cannot fly, uh, run. If you cannot run, walk. If you cannot walk, crawl. But whatever you do in life, make sure that you're moving forward. Okay. So you have to compare yourself every year. And I would encourage everyone to that Christmas is coming and New Year is coming, and everyone likes to make resolution, but spend some time, 15, 20, 30 minutes, and try to look and analyze at your life to see what kind of person you were last year and where you are today. Okay. And set a goal for yourself for the next year or 5 years or 10 years, that I want to be at that point in the coming 5 years or 10 years. And then try to break it down into smaller achievable goals in order to get there. What do I need to do? If there is a certain career that you want to aspire, what are the steps that I need to be there? And try to break them down into simple steps. Okay, this is the first step. Try to prioritize your career goals and keep knocking off one step at a time. If you want to climb a building, you just have to take one step at a time. You know, if you try to look at the all the staircase, it might boggle you down that, oh, I have to take 365 steps to in order to reach story 8. But if you just focus on one step at a time, it is just a matter of time before you are at the place you want to be. So to make long story short, what I want to say is that don't get bogged down by stumbles or obstacles in your life. If you're determined, if you're passionate to be something, there is no power in this world that can stop you. So you just have to have strong faith in yourself. And this world has a lot of opportunities, and this world will always continue to provide opportunities to people who are willing to succeed. Okay. So my humble advice and suggestion to everyone is that have faith in yourself and keep working hard, and you will be successful in whatever you want to do. It's just a matter of time. Don't give up ever.
Thank you so much for that powerful advice. I think it's very important that many young people get motivated by that and that they keep working hard, like you mentioned. So, those were all the questions that I had. Is there anything else you would like to talk about that we didn't cover?
Yeah, just carrying over from what I earlier said, while you're working really hard, especially in your earlier life, make sure that you take out some time to enjoy your life too. Okay. Um, it is very important when we are at early steps in our career that we want to slog in and work very hard. At the same time, uh, there is there is a way that you can achieve a nice balance in your life too. So try to be a good human being is what I'm trying to say. So try to be a good student, try to be a good son or a good daughter, and try to be a good brother or good sister, try to be a good neighbor. And if you one day at a time, if you keep working on yourself over a period of time, you will see that you are slowly evolving into a better human being in your life. So this is not something that is going to evolution takes time, right? If if you want to be successful, it's not going to happen by a revolution, it's going to happen by evolution. And if you keep on working on yourself one day at a time, try to be better than what you were yesterday or a month before or a year before, you your personality is going to evolve, and you will feel the difference. You will feel a positive energy within you that is going to propel you towards success. So just keep take one day at a time and prioritize your goals and work on them slowly, and just keep faith in yourself, and you will get there. There is I have absolutely no doubt that anyone can be successful in this world, no matter where you are in this world or what obstacles or challenges you are facing. You If you have the resolve to improve and be successful, there is no one in this world that can stop you.
Thank you so much for sharing that powerful advice. And I think you've covered a lot of good stuff today. And so if anyone has any questions before we wrap up, then now's the time to ask them. And if and I would like to thank you so much for speaking today. I really enjoyed how you explained about dialysis and how kidneys work and how dialysis helps to purify the blood. And I think it was really helpful for us to understand because many people don't really know much about this field, and you helped explain it very nicely. And I think that it's very important that we know more about doctors and other different fields as well. And I think you helped explain that to us. And I think it was a great experience listening to your speech and all the nice advice you gave us about working hard. And I would like to thank you for speaking today. And many others in the chat have also said thank you. So with that being said, thank you so much for attending and thank you for speaking.
All right. Thank you, Nikhil, for this wonderful opportunity. And if there are questions that I may not been able to answer, feel free to reach out to Nikhil or email it to him or post in this forum. And Nikhil can get all those questions. And I'll be more than happy to reach out anyone in this country or anywhere in the world. If I can be of help to any single person in any way, that would be a privilege for me.
Yeah,
So
so
thank you for this wonderful opportunity.
so if anyone has any questions, just send them to me and I will get back to you after consulting Dr. Sharma. Thank
Thank
you
you
so
and
much.
have a good day.
You too.